Hi, I'm Andrew Jimenez, and my county profile paper was on Sutter Amador. Amador County. Sutter Amador is a hospital. I've done this too many times. Okay, so Amador County is right here, just east of Sacramento. It's that shaded area. So it's actually rather wine country, and it's referred to as the heart of the mother lode because there's actually a very big gold mining destination back in the gold rush. Currently has a population of about 37,000 people, with the population being predominantly white and over 85% of the population being adults, so over the age of 18. Jump right into health insurance. UCLA Center for Health Policy Research stated that Amador is above state average when it comes to the access and utilization of healthcare insurance. Only about 16% of the population is uninsured compared to 26% for the state average. A majority of the population receives the health insurance through their employer. When it came to hospitals and physicians, I only really found one major hospital within the county, which was Sutter Amador. I mean, I really looked for other hospitals and primary care centers, and it was nothing like the nothing major that you would consider primary care. So it's a nonprofit. It's categorized as a general acute care hospital with basic emergency services and no trauma center. Only about 52 licensed beds are available to patients, and a shortage of services does exist there. It's very common with hospitals in rural areas, whether it's California or like the whole world. Um, so pretty much something that was rather uneasy about it is that when it came to physicians and surgeons within Amador, there were only about 60 active licenses registered with the Medical Board of California. So when you break this down in terms of physicians per 100,000, per 1,000 population, it's only about 1.6 physicians per 1,000 people, where Los Angeles County is a lot closer to 3 physicians per 1,000, so almost double that. Okay, next, children's health. Only 15% of the population is under the age of 18 years old, so they have a small child population. 61% white, 21% Latino, 1% African American and Asian, and the final 8% was listed as other. Um, Education excelled in terms of having classes that were taught by highly educated professionals, seventh graders who exceeded math standards, and actually having 83% of their seniors, high school seniors, graduate on time, which is a pretty good statistic. The struggling points in Amador's child health are schools lacking health centers, and actually there being a lack of management or lack of management plan when it comes to child conditions like asthma. And this is kind of due to the fact that there's a lot less specialists there. Okay, let me. So, California Office of Statewide Health Planning and Development declared Amador a primary care shortage area in 1994. It's a geographic designation that states the county is what is referred to as a medically underserved area. And Sutter Amador, the hospital I previously talked about, was declared a MUA pretty much in 1994 and has been the same ever since. So health outcomes and factors. Amador County ranked 30 amongst the California's counties in terms of health outcomes. Um, the bad health behaviors were smoking, alcoholism, and then diabetes, which isn't a behavior, but I mean it's a health crisis. Um, they were below average when it came to residents having access to appropriate exercise. And there's actually let me see. Okay, when it came to the issues in Amador, one of the big problems was that it's most affected by delays in healthcare services. So whether it's going and having to set up an appointment and finding a doctor that can cater to you, or actually one of the bigger problems was the recorded 93 injury related deaths in 2015, which is compared to the California average of 46. So literally double that injury related deaths, and it's related to rural residents being twice as likely to die from incidents such as car accidents, gunshot wounds, or health complications like a heart attack. Um, they take place because emergency medical services like ambulances and things of that nature are scarce in these counties, and it being so everyone's so far away from the hospital that it takes a lot of time for emergency services to actually come and tend to a person. So I mean, if you drove your car off the side of the freeway in the middle of the night and no one saw you, chances are like you would go ahead and die because no one's gonna see you. Even if you were to be able to call, it's gonna take them a pretty good amount of time to get to you. So that was really like the main problem in Amador County. And there was also a problem of there being no appropriate forms of exercise for residents. My solution to these problems was my first one that pertains to there not being, enough exercises was they have pretty much like they can set up. I mean, it's pretty much on since it's such like a not it's not a very well connected county. Sorry, it's not a very well connected county. So I mean, there's not like a big sense of like, hey, we're all gonna work out, like we're all gonna improve our healthcare outcomes and exercise. So the best thing that Amador County can do is maybe, along with the mail, provide its residents different activities and workouts that they can do. And then even like they have parks that they make nowadays that are actually they have the workout equipment it uses your own body weight. So I mean they might have elliptical or pull-up bars, things of that nature that residents can take advantage of them if they want to. And then when it comes to there being injury-related deaths due to like lack of emergency services, their best bet would be to kind of coordinate emergency services. I mean, it might be kind of hard because they're understaffed. They even have like volunteers that work for their emergency medical services. Maybe if someone could go ahead and coordinate them in like certain areas, that way they're kind of spread out a little more. So if it turns out that people do need services in an area, there's already emergency service nearby or ambulance. I mean, within a certain range, and I would even buy a helicopter. I mean, I know that sounds kind of like far fetched, but I mean, they're really a medically underserved area, and maybe they only have one hospital, so if they had a helicopter that could bring people to and from that hospital, or it would just help a lot with the response times and hopefully reduce the injury-related deaths that they experience. All right, so that's pretty much it for Amador County.